Hey guys, hi. Today we are going to speak about something that a lot of patients forget to ask me when they are having their abdominoplasty or tummy tuck done. That is about their umbilicus or their navel. We decide on things as where the navel will be placed, how it will look, and other things as well. So, hi, I'm Dr. Saumil Shah. I'm a board certified plastic surgeon. I'm the director of plastic surgery at Skin Zone Clinic, Mumbai, and we'll be speaking about umbilicoplasty in this video. First, understand what a navel or an umbilicus or a belly button is actually. When a baby is when the fetus is in the mother's uterus, there is a connection between the mother and the baby so that the baby receives nutrition from the mother's blood. This connection is what is the umbilical cord. This umbilical cord is cut off at birth and it shrivels and falls off after a few days. This then forms a scar. Almost every one of you who's seen a newborn baby has seen this umbilical cord and how it falls off. This scar that is left as a depression on the skin is what is then seen as a navel or a belly button. This umbilicus, what happens is actually just not a scar on the skin. This scar then actually goes down from your skin right down to your muscles and then through the muscles into your abdomen. This entire scar tissue is what we describe as an umbilicus or a navel. So in a tummy tuck surgery, what we basically do is cut out the skin. This skin that we cut out goes up to or above your navel. When we cut the skin out and pull it down, the navel is inside we cut the navel out and it lies inside or below this stretched skin. Now we have to get this umbilicus or navel out onto the surface. So we make a tiny slit where the umbilicus sits. We open that up and suture it down to the native umbilicus. This is what happens in all simple umbilicoplasties or normal tummy tucks where we need to get the umbilicus out. When we do this, the thing is that there are different shapes that an umbilicus can take. There are different means or positions in which the umbilicus can be gotten out. This is the nuance that you need to speak to your surgeon about as to how you will see the umbilicus coming out, what will be the shape of it, whether it will be an innie or an outie, what are the differences between the two. And this is the part that you will need to discuss with your surgeon. When somebody has an umbilical hernia, what happens is we saw how the umbilicus is a scar tissue. It's a solid fibrous structure that goes from your skin down to your abdomen. During pregnancy or because of excessive weight gain or because of decreased tone of your musculature sometimes, this fat then canalizes. So the solid structure of the umbilicus, it basically causes a canal that opens up through the umbilicus, and this fat or the intra-abdominal contents like intestine is pushed out through the canal of the umbilicus and it comes up to your skin. This is when many times the navel or the belly button from an innie becomes an outie. That is, sometimes you lose this depression that is there in your skin, which is actually a umbilical hernia. A hernia is nothing but the tissues from below your muscle coming through a defect through your muscle to the outside. This can be in any part of your abdomen. When it comes through your umbilicus, it is called an umbilical hernia. So in an umbilical hernia, we cannot just pull the tummy down because you've lost your umbilicus. Now we need to create a new umbilicus. So after pulling the skin down, we can't just get the belly button out because there is no belly button to get out. What we actually do is create a new belly button, which is a procedure called as Neo-umbilicoplasty, which is a new umbilicus creation. There are two ways of doing it. One, we make a slit in your skin, get all the skin down according to the shape that we want and according to the size that we want. And then we take a small skin graft from the removed skin and we put it at the bottom, and this is a new umbilicus that is formed. You have to understand that we are not actually forming the entire scar tissue that goes down through your muscle. This is just a cosmetic procedure to create a look of an umbilicus. A second way is also very similar, where we just take the skin that is outside and we create a depression in the abdomen and that depression looks like an umbilicus or a navel. So these are the two ways where a neo-umbilicoplasty can be done for a patient who's suffering from an umbilical hernia in whom we do a tummy tuck surgery. So guys, this was about umbilicoplasty or how we deal with an umbilicus during a tummy tuck surgery. If you have any queries or have any issues regarding what different problems can happen with an umbilicoplasty, what are the complications that can happen, we'll try to make a new video for it sometime in the future. If you have any other questions, do give us a call or do connect with us on our social media platforms, or you can just ask your question in the comments below.